Hi, class. This is Dr. Weaver. Today we will be talking about a little about inflammatory intestinal disorders, care of these patients. This information is in chapter 57. Um, this is essentially talking about the GI system. What is the GI system, or what is the function of the GI system, preferably? The function of the digestive system is digestion and absorption. Digestion is the breakdown of food into small molecules, which are then absorbed into the body. The digestive system is also divided into two major parts. We have the digestive tract, or also AKA alimentary canal, which is a continuous tube with two openings, and that is the mouth and the anus. So at the end of this self-study of Crohn's and ulcerative colitis, the student would be able to do the following. Differentiate pathophysiology and presentation of common types of acute inflammatory bowel disorders, or IBD. And this is namely talking about, again, ulcerative colitis and Crohn's disease, excuse me. We want to prioritize care for patients with inflammatory bowel disorders, discuss the purpose of and nursing implications related to drug therapy for patients with an inflammatory bowel disorder, and also to create an evidence-based plan of care for the patient undergoing surgery for an inflammatory bowel disorder. And here we're talking about, in particular, colostomies and ileostomies. Now, you notice I talked about self-study. We didn't have enough time for me to do a full-on lecture on this particular area. So what I'm going to, in one of these slides, I'll talk to you about some areas I want you to take a look at. I will also be sending out a self-study, or excuse me, a study guide to guide you as to what areas to really place a lot of focus on. But I would like for you to read the different areas or sections that I will also mention, and I think you'll be fine. So take a look at this image, and it shows a depiction of Crohn's disease, and this is to the left, and ulcerative colitis, and this is to the right. Now, notice also, and I have this in your notes, for Crohn's disease, we're talking about mostly the small intestine is impacted, although it can affect the large intestine, but mostly the small intestine. And of course, ulcerative colitis typically only affects the large colon, as you can see in the picture I have here for you. So anyway, we know the intestinal tract is made up of small and large intestine, the latter being the colon. Continuous digestion and absorption of nutrients occurs mainly in the small intestine to meet the body's energy needs. Now, water is absorbed mainly through the large intestine to help maintain fluid balance and promote passage of waste products. See, another organ that helps to rid the body of waste products. What's important to know is when intestinal structures are inflamed, and in both these conditions, the intestinal structures are inflamed. Resultingly, nutrition is going to be inadequate. What I want you to do is to read pages 1150 to or through 62 about this chronic inflammatory bowel disease called ulcerative colitis and of course Crohn's disease, paying attention to the pathophysiology. I want you to look at table 57-4 about complications of ulcerative colitis as well as Crohn's disease. On page 1154, I want you to look at a discussion about ostomies, be that colostomies as well as ileostomies. Look on also page 1157, chart 57-4 about care of ileostomies as well. And also look at the care coordination and transition management section on both these conditions. I will provide some specific areas of focus, as I mentioned, but still you need to read this for your HESI, your NCLEX, as well as for practice, the clinical practice area. Make sure if you get stuck on any areas that you reach out to me and we can discuss this information further. Here quickly, I just wanted you to look at this picture. This is an exemplar of an ulcerative colitis. Yes, this is what somebody's colon, this is what it looks like. So as you can imagine, it would be very difficult for this area of the colon to manage water as well as the excretion of waste products as well. So these are problems I want you to watch for with these patients. When we talk about priority collaborative problems for patients with ulcerative colitis, these would include diarrhea due to inflamed inflammation of the bowel mucosa. There's acute pain or chronic non-cancer pain due to inflammation and ulceration of the bowel mucosa and skin irritation. Remember from the diarrhea, lots of acids in there, or base, shall I say, causing skin excoriation and irritation. There's also potential for lower GI bleeding and resulting in anemia due to the ulcerative colitis. So whenever you think about ulcerative colitis, just think about all these particular issues, and these issues actually become your priority. So as a nurse, you are looking for a decrease in diarrhea. This can be managed by drug therapy, by nutrition, and also by surgical management. Again, surgical management, these patients might require an ileostomy as well as a colostomy. They also may require a resection, surgical resection of these affected areas in the small, large intestine. We want to also minimize pain. We want to also monitor for lower GI bleeding. And it is also important to understand what the care coordination and transition management needs might be for these patients, especially as we discharge them back into the community. And so here, I want you to look at Crohn's disease. This is what the small intestine looks like. Note the cobblestone appearance of the intestine. Now, Crohn's disease is a chronic inflammatory disease of the small intestines more so, but as I mentioned, it can affect the large colon. It can affect the GI tract from the mouth to the anus, but mostly affects the terminal ileum. It is a recurrent disease with remissions and exacerbations. So just take a look at this really awful appearance for this patient. And this is the section that when I talked about removing certain affected sections. this would be one of the sections removed, I'm sure.